Okay, so I'm Lisa Bortolotti, and I coordinate the activities of the Women in Philosophy group at the University of Birmingham. And today we have a guest speaker, so we are delighted to welcome Elly Vintiadis from the American College of Greece. Her talk will be on psychedelics and assisted therapy. You can share your screen, Elly. Thank you very much.
1 second, let me do this again. Sorry. There you go. Can you see can you see the slide?
Yes.
Okay. Okay, so thank you, Lisa, for inviting me, and thank you everyone for being here. What I will talk about is the problem of informed consent in psychedelic-assisted therapy. And this is a problem that has gained attention lately. But I think that the focus of this attention is wrong. So I'm going to present why I think this is the case. Now, this is work in progress. It's actually not really even work in progress. It's something I've been thinking about, but it's the first time I present it. So any comments or criticism you have would be very much appreciated. And I apologize for the creaking of my chair if you can hear that. So psychedelic-assisted therapy is psychotherapy that is combined with the controlled administration of psychedelic substances. These include the classic psychedelics like LSD, DMT, mescaline, the ones that we usually associate with hallucinations. But they also include ketamine, MDMA, and ibogaine. And in recent years, psychedelic-assisted therapy has gained attention, and there's substantial evidence that shows its safety and efficacy, especially when it comes to antidepressant, anxiolytic, and anti-addictive effects. And one of the things that happens during psychedelic therapy is that many subjects of PAT, psychedelic-assisted therapy, report having mystical type experiences that lead to important insights that change their views on life and its meaning. And it's this transformative potential of psychedelics that is the reason that they have been used for centuries in spiritual and healing practices. Now, according to Laurie Paul, a transformative experience is one that changes a person both epistemically and personally. Now, for instance, becoming a parent is a personally transformative experience in that it changes in many ways who you are. It changes your values, your life goals, your personal preferences, and it does so in ways that trickle down to other parts of your life. And other transformative experiences could be losing a parent or going through a divorce. But the new sensory experience can also be transformative in the sense, for instance, like tasting Marmite for the first time, in the sense that you acquire knowledge that you could not have gained otherwise. So you can't know what Marmite tastes like if you don't you don't actually take a bite of toast with Marmite. And the important thing here is that in both cases, the content of the experience is epistemically inaccessible prior to you having the experience. Now, because of the renewed interest in psychedelic therapy, and precisely because of its distinctive transformative character or the potential for transformation, questions concerning informed consent have been raised. There you go. So the basic goal of informed consent is to protect the autonomy of patients and ensure that decisions made about medical interventions are made voluntarily and with a full understanding of the possible consequences. So the aim of informed consent is to protect patients from harm, but it also protects therapists and physicians from accusations of wrongdoing. And in order to get informed consent, we require three things. First, that consent be informed in the sense that the person giving consent has adequate information about the risks, the benefits of the procedure, and also the whole procedure itself. Secondly, that the consent must be voluntary, so the person must not be coerced into giving consent. And third, that the person giving consent needs to be capable of making a decision. So that means that she's able to understand the information given to her and can reason with it in order to decide how she wants to proceed. But when it comes when it comes to psychedelic-assisted therapy, informed consent is seen as more complex compared to traditional forms of therapy. And the reason is because the emphasis in informed consent is on intellectual understanding. And the problem, the core of the problem is that the psychedelic experience, as I said, can be potentially transformative. And the problem relates to rational decision making. So when I make a decision, I project into the future based on my current beliefs, values, and preferences. And then I assign a subjective value to the options before me. And for the decision to be rational, I need to weigh the possible options and choose the one that has the highest expected value for my future self. So I need to be able to project and evaluate the potential outcomes. But in the transformative experiences, the values and preferences of my future self have changed. So I cannot make a rational decision since I do not know what my future values and preferences will be. And so I cannot assign a subjective value to the future experience. And therefore, the argument goes, it's impossible to make a rational evaluation of these changes before choosing to undergo them. And this is a problem for transformative experiences in general and informed consent, but also specifically for psychedelic-assisted therapy. Now, the first question to ask in this context is whether psychedelic experiences are transformative. Now, as I said, Paul defines a transformative experience, one which is both epistemically and personally transformative. But the thing with psychedelics is that psychedelics have different effects on different people. And of course, they have an epistemically transformative element, or they can have, but in the sense that all new experiences have an epistemically transformative element. But it's not always the case that they are personally transformative. Sometimes they are. There are subjects who have said that they had intense mystical experiences that changed the way they see themselves, that changed the way they see the world and their relations to people around them. But this is not the case for all people. For many patients, the effects are transient, and the patients return to the previous mindset after some time, sometimes weeks, sometimes after 6 months. And for some people, they don't have transformative experiences at all. So these experiences can be epistemically transformative, and they can lead people to gain new knowledge about themselves and the world, or entertain the possibility that they haven't before. They can entertain the possibility that the self doesn't exist, or that they might find out for the first time that there's more to reality than the physical world. And this can make you more open, more receptive, and have all sorts of other behavioral effects. But that doesn't necessarily lead to a fundamental transformation of the self in the sense of a personally transformative experience. And there's also the problem that determining what exactly counts as a transformative experience is very difficult to do. Because firstly, we don't have objective criteria for what counts as a transformative experience. And secondly, because the fact that something moves you profoundly, or you find something extremely meaningful or spiritual, doesn't necessarily mean that it changes who you fundamentally are. Sorry. But the second question to ask is whether, even if we consent that such experiences are transformative, does this really pose a problem for informed consent? And now, as I said before, to give meaningful consent, the patient must be informed and have a clear understanding of potential risks, benefits, and the nature of the therapy. But informed consent doesn't require that you know everything, all the possible outcomes. That's arguably impossible, and it would be unreasonable to require it. What is reasonable to require is that the patient has the ability to understand the relevant information, understand the risks, or the possible risks, and make an autonomous decision. So in cases of transformative experiences, we might not know exactly how our preferences will change, but we can still consent to the process of experiencing transformation. And in fact, many individuals who pursue psychedelic therapy are seeking for precisely that. maybe people who have treatment-resistant depression have tried everything else and want to try this, and they go to great lengths to achieve it. They invest time, they invest effort, and they invest a lot of money, because at this point it costs a lot of money. So in this sense, I think it seems possible to have meaningful consent. And Paul herself at some point suggests that instead of focusing on the outcome of the transformative experience, we focus on the evaluation of the process from a current situation. So instead of asking whether we should have an experience, we should ask whether we want to have an experience that might change us in fundamental ways and in dramatic ways. The other thing is that we can also often know enough to consent. For example, I might understand that certain experiences, like becoming a parent, can lead to profound changes, and we can try to inform ourselves about this, and we can get substantial information about this. We can read books, we can watch movies, we can talk to people who are already parents, and so on. And though there's a distinction that is drawn between psychedelic-assisted therapy and psychotherapy generally, the truth is that all psychotherapy is, or at least aims to be, transformative to a certain extent. So either in the sense that we change fundamental aspects of ourselves, or in the sense that we relate to ourselves and our mental states in a different way. And it always carries a degree of uncertainty regarding the outcome. Yet we generally do accept consent in such cases. So in this sense, consent in psychedelic-assisted therapy is not very different from consent in other medical procedures, including things like major surgery. If you think of organ transplants or gender-affirming therapy, where again, the experience can be transformative and the full consequences cannot be anticipated, we do accept consent in those cases. And we do so based on making sure that the patient has an understanding of the potential risks, not of having complete information about what will happen. So though the transformative aspect of psychedelic-assisted therapy is what is emphasized in the literature concerning informed consent, I think this focus misses the point, because like in the case of other transformative experiences, we can typically accept consent. So something else is going on here. And I think that this needs further explanation. And I believe that this is due to two reasons. The first is that psychedelics are moralized in the West and still carry a lot of stigma, because psychedelic-assisted therapy is doubly stigmatized. It has to do with mental health, and it has to do with drugs. So the problem is not really that they are transformative experiences. I think the problem is the way the experience comes about. And the second reason, I think, has to do with how the bioethical discourse in the West is structured, because bioethical discourse is grounded in normative principles developed within and for the framework of Western medicine. And this, I think, shows the limitations of the Western bioethical model when applied to non-Western healing practices. So first of all, let me take up the question of moralization. Now, psychedelic-assisted therapy was researched in the 50s and 60s very much, until the signing of the Controlled Substances Act by Richard Nixon. That classified psychedelics as Schedule I substances, which means that they have no medical use, they have a high potential for abuse, and therefore they become illegal. And this, I say this very quickly, there were a lot of different social forces that played into this decision. So this reinforced the perception that psychedelics are dangerous and addictive, and led to fear and moral panic surrounding these substances, which still, to a large extent, persist today. But today we're going through this renaissance in the field, and some people talk about paradigm shift, and they see psychedelics as the miracle drug. But on the other side, they're also concerned that this is a bubble and that all this is a case of scientific hype. And the concept of hype is a concept, I think, introduced by Intelman, who defines it as the implicit or explicit exaggeration of the benefits or the evidence supporting those benefits of a treatment in science communication. And this hype has also fueled what we call psychedelic exceptionalism, the idea that psychedelics are so different from other drugs that special rules should apply. So for instance, it's very difficult to have blinding in trials with psychedelics, precisely because the effects are so intense and so obvious. So according to psychedelic exceptionalism, we should have different rules when it comes to blinding for trials with psychedelics. And this is seen as problematic by many people. Or when psychedelic exceptionalism can lead to the idea that we should legalize psychedelics, but not other drugs. And this, again, opens a whole can of worms. But apart from this psychedelic exceptionalism, I think it can also lead to a sort of negative psychedelic exceptionalism, leading to the belief that rules concerning the use of psychedelic must be stricter because there's more risk associated with their use. And so there's reason to worry and be extra cautious about their use. And of course, this can lead to dismissive attitudes about the use in therapy. Now, though it's true that hype surrounding psychedelic-assisted therapy has led to exaggeration about the evidence available, it's important to make the connection here between hype and moralization. And Elisabetta Lalumera has argued that values enter medical practice through the process of moralization. So this is a process through which preferences are converted into values at both the cultural and the individual level. And I think this also applies to psychedelic-assisted therapy. And in fact, Elisabetta Lalumera and her colleagues have written recently a paper about that. So I think this moralization applies to psychedelics and the often exaggerated worries about the possibility of consent. Because the process of evaluating something as morally right or wrong affects our appraisal of evidence, as Intelman points out, but it can also bias our appraisal of the risks associated with different therapies. So in this sense, we can talk of a sort of negative hype. Instead of exaggerating the benefits of a kind of treatment, we exaggerate the risks and difficulties associated with it. And so psychedelic-assisted therapy comes to be viewed as exceptional in terms of informed consent, when it is not, because we typically accept that people can give meaningful consent for transformative experiences. Excuse me. And I think the effect of fear and moralization can be seen in the case that Faden and Beauchamp mentioned in the discussion of deceit in the process of consent. They write, in a study comparing effects of LSD with a placebo, the subjects were not told that LSD was involved, but rather were told the full chemical name, which would not be recognized by most of the subjects, and the known and suspected effects of LSD were described to subject in detail. It was felt that using the technical name and describing possible harmful effects was adequate information, and that actually using the term LSD would have caused many subjects to refuse to participate on emotional grounds. While they might have been willing if they were specifically told about suspected harmful effects. Since the technical name was a correct one, and the suspected effects correctly described, the research was probably covered legally, but ethically, I'm not so sure. So what this excerpt describes is that when subjects were given all the relevant information available about the drug, but were not told that it was LSD, they had no objection to its use. They consented to its use. When the name changed and the term LSD was introduced, the reaction changed. And what I think the name adds is the emotional associations that Faden and Beauchamp referred to, but also the moral attitudes attached to the name. The second reason, I think, has to do with the changing context in which psychedelics are used in healing practices. Now, when we talk about the colonization of psychedelic therapy, we refer to the process where psychedelic substances, which were once originally used by certain indigenous and traditional healing practices, are appropriated and transformed by Western institutions. And the problem, I think, here is that the discourse on informed consent is grounded in normative principles developed within the framework of Western medicine and for the framework of Western medicine, in which individualism, rationality, and autonomous decision-making are central. But these do not fit practices rooted in traditions that are very different from modern-day Western cultures. And in this sense, the problem of consent as raised for psychedelic-assisted therapy reveals the limitations of Western bioethics when confronted with such healing practices, non-Western healing practices. Now, in the West, we usually understand consent in the context of consenting to something done to you in an environment separate from everyday life, such as a hospital or a doctor's office, where there are clear power dynamics and the authority rests with a medical professional. And we also understand the process of informed consent as a decision to be made by the individual, privately, rationally, and often under conditions that emphasize autonomy, control, and legal accountability. But this is very different from the context in which psychedelics have been used in indigenous cultures, and I think we can learn from them. So in many indigenous healing practices, the use of psychedelics is communal, and it's not about just the individual seeking treatment for some ailment, but it's also about connection with the past, the present, the past, so with ancestors and spirits and things like that. It has to do with the present and the future, and it's grounded in a broader worldview, which is built very differently than our worldview. It's built on relationality, interdependence, and community. So it goes well beyond an individual, and it involves the healer or the guide. It involves members of the community. And psychedelics are not just tools for healing, but they are means of self-discovery. And they are means of maintaining a balance between yourself, within yourself, between yourself and the community, but also between yourself and the natural world at large. And in such contexts, consent is not individual. It's very often communal and it's relational, and it's communicated through ongoing participation in practices within the community, and generally with respect to spiritual and cultural practices. So the contrast between the Western medical framework and the indigenous healing practices is quite stark, because Western medicine emphasizes individualism, rationality, control, and with healing practices that are very often passive. But indigenous healing practices emphasize transcendence, they emphasize surrender and spirituality, and are often active, participatory, and embodied. And they're also rooted in mystery. And these are the unknown elements of the process are an essential part of the transformative process. And this unpredictability and mystery inherent in indigenous rituals presents a challenge for the Western emphasis on control and rationality. And in fact, you can, there are papers in the literature where they try to distinguish psychedelic-assisted therapy from all the mysterious aspects that are to be found in indigenous practices. So this tension between the two contexts, one on control, rationality, and predictability, and the other one on mystery, surrender, and spirituality, I think reveals the limitations of applying the Western informed consent model to a therapeutic modality that has taken many elements from indigenous healing practices. So when we move the use of psychedelics into a clinical context, even while we make the setting as comfortable and appropriate as possible, we simplify an experience in ways that make it challenging to fit the model of medical informed consent. But nonetheless, we have appropriated psychedelics into therapy, and we need to find a way to to get legal, to satisfy the legal and ethical requirement of informed consent. So we need to reframe it in a way that preserves its protective function, but that also makes space for the nature of psychedelic-assisted therapy. So because of the transformative potential of psychedelic-assisted therapy, and also the suggestibility of people under the influence of psychedelics, many people have proposed that we need an ongoing discussion of risks and benefits, not just before the therapy takes place, but throughout the process of the therapy and after the treatment of the process. And we can do this, we can address this with a more dynamic and ongoing process of consent, an enhanced consent model. So that goes beyond simply providing information and securing consent beforehand, but we constantly return to the person undergoing therapy to see how he's doing, and whether something has changed. So this not only builds trust, but also empowers the patient. Because of the potential intensity of the psychedelic experience, and because it's the possible irreversibility of the effects, and also because you need to be open to this kind of therapy and let go. You can't try to hold on and control everything. I think consent should be contextualized as part of, not just in terms of clinical outcomes, but as part of a larger process of healing and growth and self-discovery. So in this sense, the patient changes roles. Instead of being the passive recipient of care, they become active participants in the healing process. And this, I think, ultimately can help them integrate the experience more meaningfully into their life. So in such a model, the therapist does not direct the therapy, but co-creates it with the patient. And I think this resonates with the notion of relational autonomy. And it's also more in line with some indigenous healing frameworks in which consent emerges from being embedded in communal relationship, not just giving information. And lastly, since psychedelic experiences may be transformative in unpredictable ways, I think the process of consent should acknowledge the role of mystery and the unknown. So rather than attempting to predict or control the experience, consent can include discussion of the spiritual and unpredictable dimensions of the process. And this echoes, and to a certain extent, pays tribute to the traditional and indigenous healing frameworks in which uncertainty is embraced. So in this context, the mystery of what is going to happen isn't a barrier to autonomy. It's often the point of the journey. And this kind of consent is not uninformed. It is differently informed. It is contextual and relational, and depends on preparation that acknowledges the mystery and the unpredictability of the experience. Thank you.